In 2025, Maine set another record for the number of tick-borne cases reported statewide. The Maine CDC reported about 3,700 cases last year, an increase of more than 400 that was reported in 2024.
News Center Maine's Vivian Lee reports that experts think more awareness of the health risk and warmer climates caused by climate change could make the trend continue.
Experts are paying close attention to this health trend as it grows more worrisome.
Unfortunately, broken the record for the big three tick-borne illnesses: Lyme disease, anaplasmosis, and babesiosis.
In 2025, Maine broke its record for tick-borne disease cases for the third year in a row. The Maine CDC reported that there were more than 3,600 Lyme disease cases last year, more than the year before. The University of Maine Tick Lab also reported more records.
We did receive nearly 5,500 tick samples, which is roughly a 14% increase compared to 2024.
Just turn on a second.
People can send ticks to the lab to find out the species and if they carry diseases. About 3/4 of the samples were deer ticks, and around 40% had the bacteria that causes Lyme. Dill says warmer winters and drought can change how active ticks are, and more people going to the doctor for tick bites may also be raising the number of reported cases.
And as a result, physicians are obviously ordering, more of the test to diagnose these pathogens and these illnesses.
Elizabeth Nelson suffered from debilitating pain, fatigue, and flu-like symptoms before finally being diagnosed with Lyme disease 15 years ago. Nelson and her parents, Carrie and Albert, who also are Lyme disease survivors, started Touched by Lyme, the Nelson Family Project.
And we have the ILADS information on here.
The project has distributed tens of thousands of Lyme resource cards with updated information on the illness and resources for patients. In August, Elizabeth began experiencing back pain and serious stomach issues, but didn't find a tick bite.
I didn't even have to ask them to test for Lyme this time. I was pleasantly surprised. I mean, I know that may not always be the case, but at least this time I did get mostly what I needed.
Just being taken seriously in the ER and having the ER doctor say, we'll test for Lyme. We were flabbergasted. We didn't have to beg for it. That was a huge change.
Elizabeth, meanwhile, is recovering from her symptoms, and the family continues to work to raise awareness so other patients can receive testing and treatment in a timely manner. In West Bath, Vivian Lee, News Center, Maine.